I'm Jameer. I'm Education Team Director for Vatech America, and I want to welcome you to our Lunch and Learn session.
Great to be back, Jim, for another Lunch and Learn. My name is Paul Satone. I'm the West Coast Education Trainer for Vatech.
Yeah, welcome, Paul, back, and we want to welcome everybody for joining us today on this short 20-minute session. Thank you for taking some time out of your lunch hour to kind of take your office to the next step. Paul, what are we talking about today?
So today we're going to look at CBCT capture, easy and accurate, CBCT patient positioning. We'll take a look at what appliances to use and when, airway capture and guided surgery options and capture techniques. And we'll take a look at image quality issues, recognizing them and understanding how to resolve them through patient positioning.
And let's kind of look at our really our first resource here, or one of our big resources is going to be, the Vatech website, specifically the Customer Learning Center. So let me take you over to the Customer Learning Center here, and you can see I'm logged into our website here, vatechamerica.com. I'm going to go up to Service and Support, and if I scroll down and click on my Customer Learning Center right here, what we want to do is go over to our Software tab and go to Easy 3DI. So from here, it's going to ask you to log in. If you don't have an account, go ahead and click on Create an Account, fill out your information. When you choose your product, either choose the software or your device. But if you already have an account, this will already be populated. Go to Log On, and then you can see our video training. So as I scroll down here, and here's your whole host of videos that are probably about 4 minutes long. Paul, let's talk about the FAQ section. You want to run us through that?
Sure. So the FAQ section on our website is a really great resource for anything quick and easy. You may not want to call support. A quick way to avoid calling support is just to go to our FAQ and type in the search box what you're looking for. So whether it be exporting, printing, you just basically type your question or just a single word in there, and it'll bring up all the articles in relation to your inquiry. So in this case, we have exporting as the STL, surface model, export to third-party software. So depending on what you're looking at, it has an article right there, really at your fingertips with all the information you need to answer the question.
Yeah, in this case, we did export, and really our topic for today, how do we export this? And this takes us step-by-step outlining each process. So once this webinar is done, you have the option of going to our FAQ and getting that information there. So a lot of good information on our website there. So today's topic, we're going to talk about simple and accurate CBCT positioning, really making everyone's lives easier and patient interaction a lot easier and a good experience for both the clinician and the patient. So Paul, first let's define what we're going to be capturing as far as field of view, visualizing that to give an understanding to everybody of what exactly is happening when we take our CT.
The scan itself is a cylinder piece of data, and in this case, 170 millimeters or 17 centimeters, that's the diameter. So we have the diameter by the height. In this case, we're looking at a 17 by 15 image here, and that is diameter by the height.
That's really going to depend on what size comes from the doctor or the office of what you're wanting to capture. But just like I said, for this example, was the easiest to pick a larger field of view to give a good visualization there. Yeah, and then so to launch all this, we're going to go to our Easy to Eye imaging and where we have our patients. And then let's go over to our capture screen next so we can kind of talk about that. Paul, why don't you take us through really just the different fields of view, and this is what we're working on as far as the green 2. So these are going to be the fields of view may vary, but we wanted to give everybody an idea of what we can capture and what we are capturing.
So when we're in our capture screen, here we're picking our field of view on the right, whether it's 18 by 10. In this example, we also have 13 by 10, 8 by 9, and 5 by 5. We're selecting that, and we can see the scan time of 4.9 seconds in there.
Yeah, so one of the tips and tricks on here, Paul, is to get that accurate scan of the 18 by 10 or the 16 by 9 or the two larger fields of view are 9-second scans, and that 8x9 and 5x5, those are 4.9-second scans. So we get that patient in and get them out with minimizing kind of the chance for any movement there.
Right, very quick.
Yeah, and then really we just click down there and click ready on that.
Right.
Yeah, emphasizing that 4.9 seconds. Well, let's go on to actually positioning the patient in the machine, and this quick, accurate, and easy, that mid-sagittal beam, just like we do for a pan, right through the center of the face, or right through the middle of the eyes, and right through the philtrum there.
Yep. Then moving on to the axial light, a horizontal axial light to position through the center of the lips.
And this is really going to depend on the field of view. That axial light we use as kind of a reference. So here we're saying we're capturing our larger field of view, or our dual arch or both arches. And that usually will go project somewhere through the occlusion, depending on the patient's facial height. Now, Paul, it's a little different if we're doing maxilla or mandible, but that light may move up or down, right? Depending on the size.
Right. If we're focusing on a smaller scan, 8x5 or 5x5, typically we're going to want that axial light on that given arch. So in this case, we're shooting for an upper section, so we want that light approximately at the patient's gum line there.
Right, and then in the mandible, kind of the same way, it will have that project into the lower arch through there. Yeah. Right.
The machine already knows based on what you select on the screen, and it's our job to kind of adjust that based on the size of the patient. So little micro movements.
So let's do a quick summary right here, or show kind of the summary of the two positioning beams, and let's make this easy and fast, right? Mid-sagittal beam, we have our patient there biting on the bite stick. We position the mid-sagittal beam there with their chin firmly on the chin rest there, where you can see the horizontal beam, which is going to be projecting kind of through the corner of the lips. And to be clear, this is for a larger scan to go through both arches. This horizontal beam may vary, being further up in the maxilla or further inferior in the mandible. The importance is having that flat occlusion and having the patient still and not moving.
Right, definitely.
Yeah, and Paul, on our website, we do have that customer learning center where we have the cheat sheet. And let's look at that cheat sheet here next and take us through our quick bullet points. And everybody can download this from the Vatech America website in the customer learning center.
Right. This is really good to have handy to pull out, especially when you first get your machine. It goes right through each quick and easy step. First, we pull our trigger button to adjust the height of the machine, approximately 1/2 inch under the chin, and our vertical position, having them stand fully upright as possible, feet approximately 1 inch forward or vertical, holding underhand, helps get those shoulders down, biting on that bite stick, and then we move on to the mid-sagittal light and our axial light.
And you did talk about that holding with their palms facing up. That's also going to relax their shoulders down to keep them comfortable.
Right.
So let's look at proper positioning of what should the resulting scan look like. And I think this is going to kind of show us you have that flat occlusion, and this scan here is actually an 18x10, so you can see the depth, anterior teeth, back into the spine there, and then the height, inferior border of the chin down to the highway bone. Look how we are capturing TMJ and into actually the lower orbits of the eyes there. So what happens if their heads tip down a little bit too far, or they're malpositioned? You can see here, and then where we have the head tip down, that dashed line is showing us our kind of our reference line of, or imaginary line, I should say. The solid line is going to be the actual red beam on the projecting on the side of the patient's face. So what we're seeing here, we're seeing that condyle cut off and the occlusion tip too far down.
Right. If the head's too far down in this example, it's going to throw all the anatomy out of position, and that field is going to cut off, in this case, the top of that condyle.
Yes, we do want to make sure that flat occlusion there. Now, other thing we talked about is making sure that the chin is on the chin rest and they're in the bite stick, and we can actually visualize that in the scan. So I think we have a slide coming up here we're going to discuss right here. So look, this is a sagittal slide, so a slice from the side. you can see where that bite stick is at, and that their teeth are right there in the groove. And then also that the chin is firmly on the chin rest.
Yep.
On there.
Yeah, really important.
Yeah.
Yeah, just one thing I typically will tell clients, I like to grab that bite stick and just make sure that it's in there nice and snug, that they're not too, you're in there nice and snug in there.
Right, and then push down on that to get the chin on the chin rest there. So
right,
that definitely will help. And speaking of another, I guess, tip, we need to basically have some talking points here coming up, that how we're going to talk to the patient to let them know kind of what's happening. And Paul, you had mentioned before, really a lot of these on the couple slides ago, but really this kind of goes into in progression. This is another slide that can be downloaded from our website, but it's really, hands palm facing up to lower those shoulders and relax the patient. The feet, the heels aligned with the column or standing up straight or 1 inch forward of center. And then the head with the chin on the chin rest and the teeth aligned in the grooves of the bite stick are going to be really important there.
And this is a great document to have. Even some offices like to put it on the wall to show the patient while they read this off to the patient. So basically, we're talking to the patient, we're having them swallow, keep that tongue at rest in your mouth, breathe through your nose, close your eyes, just so they tend to look at the arm when it swings around. So we have the patient close the eyes to avoid any micro movements, and then just remain still for 30 seconds. And that's our patient instructions.
For sure. That's just keep it simple, get the patient in and out, helps the patient be kind of relaxed and go through there. So next, let's talk about our appliances and our different chin rests here. So at the top, you can see the taller chin rest there, and we can see the bite stick. So use those in combination a lot. We've been showing our slides where the patient has been biting in the bite stick groove there on that, but we do also have our edentulous chin cup at the bottom, and that can be used for our airway scans. It can also be used here on the short chin rest too, so in conjunction.
Right.
There, so those two. Paul, you want to talk about more of the airway scans and kind of a protocol for that?
Sure. So going to the 3D airway scan protocol, it's really simple. We're just going to use that same lower chin cup with the large chin rest in there because we want that natural airway position. So we'll use that with a large chin rest, have them right up to that rest, and stay still for that.
Yeah, so those two go there. And I think this next slide here really kind of shows a good example of that, to where you have those appliances and that chin cup together. And you can see down there where you have the chin cup right up against the patient's soft tissue there, and where they are gently closing on their back teeth there.
Yep, exactly.
Just have them relax. And then we're going to take our scan on that. And to sum it all up, this next slide really shows them in the device, temple supports closed, chin on the chin rest, and then that edentulous cup right up against the labial aspect of the chin there.
Right.
Yeah. Well, you want to kind of take us through some, one of our topics that we're going to talk about today, or the next topic, I should say, is our dual scan protocol, maybe scanning dentures and patients there.
Yeah, so we have our three points, our radiopaque markers on the denture, three on the buccal, 3 on the lingual, and I believe they're SureSmart.
Yeah, that's going to be a lot of offices and some of our labs use these SureMark markers, and then you can see how we have those placed on the denture itself. Now the question is, how do we scan this and what appliances and things we're going to use? And we're going to go through specifically for our denture scan. Let's look at our scan jig and take us through that on how we're going to be capturing there.
Yeah, so if you have purchased one of our Green CT2s or Smart, you do have this scanning jig, Sarah. So simply we just take out the chin rest, the regular chin rest, and it pops right out. You just put this right in the, line up the holes, place it in there. lay it flat down. There's a little arch diagram on it that shows you the position, and we can line it up with that mid-sagittal laser beams, similar to what you would as a patient, just right down the center of it.
And so then once we have it on there, let's go to our capture screen and see what and how we're going to be capturing with that capture screen there. So kind of like before, we're used to our positioning with our patients. We're going to use really any of our fields of view. I find that the 13 by 10 or the 12 by 9 is easier because it's a little bit larger scan.
Yep.
And then other thing we want to check out is changing our KV and our MA. So the KVP, change it down to or up to 90, and change our MA to 9.
Yeah. And you can just manually click those arrows to adjust those on the fly.
Correct.
And then when you go and take another scan, it will reset back to the defaults.
Yep. And then, so the next step, so let's say we have our denture scan. What is the next step for our positioning protocol or dual scan protocol here, Paul?
So we're going to scan the denture with the patient.
Yeah, so we have our patient wearing the denture. Really, it's the same thing we've been doing. Go to our scan. Do not need to make any changes. Just take that patient scan wearing the denture, and that's really going to be the end of our dual scan protocol.
Right, and I would say Jim, maybe one thing, we scan it straight DICOM format. We don't use the model scan setting for that, for the scan.
Correct.
All right.
Okay, so once we've really went through a lot of topics here today, I think we should kind of round this session out with, once we've taken the scan, understanding and how do we look for any patient movement we might have, or really image quality here. And one of the things that is really important is to make sure that the patient does not move.
Right.
So let's go here and let's look at the scan. And Paul, why don't you kind of take us through these next 2 or 3 slides and talk about patient movement? How do we avoid that, or how do we recognize it?
So some of these key things you can look out for, and I think we've gotten in the habit of just noticing when there is movement in the scan, because you can see even here that we do have some ghosting on those anterior teeth. Right there, you can see the lips even have some ghosting on it. It's like a doubling, kind of similar to the ghosting you see on a sensor image, an intraoral sensor, right there. And you can see on the lower teeth there, you can see a doubling there, ghosting on the lower teeth as well.
Yeah, so you get that double image where that patient has moved. And I think this next slide kind of shows us more from an axial cut where we have some ghosting. And see that streaking effect through there. We'll really get that streaking off of that hard tissue there. That's going to show us those issues.
Right, and the graininess a little bit is from that as well.
Yeah.
And then,
now, I would like to see a really nice clean image, and let's look at that next. So there's your kind of your movement, but look over on the right-hand side where we do have that axial slice of that missed canal. You can really see the detail that we have on there. You can see the PDL space and everything through there. So really important to make sure that the patient does not move.
right, absolutely.
Another thing we talk about a lot of times is called micro movement, and that's where the patient just barely moves, but there's some really easy ways to identify that here.
The top image, you can see we have some distortion there. They may not even look like teeth. They kind of, sometimes it looks like, because of that movement, it'll just kind of blob up because it basically multi-images into one. So sometimes you get that distortion from the movement like that. So looking at that 3D and just making sure the shape of the teeth are outlined as in the image below. I always look for that.
Yeah, and that'll really show that higher IQ of, you can see on the top here where you have that blurriness in the bottom where it's nice and clean and clear there. So really kind of what we've talked about is utilizing the proper appliances with proper patient positioning. This should be an easy technique, right? Put the patient in the machine, make sure that their chin is firm on the chin rest. They are lined up center, flat occlusion. Either using the bite stick or the chin cup, just relaxing, closing their eyes, and then taking the image. We can always have our patients sit down in a chair if needed, or stand up if necessary. And then we went through that dual scan protocol and now kind of looking at some image quality here.
So thanks for joining us today for our quick lunch and learn session. If there's any questions you guys may have, please feel free to reach us at education@vatechamerica.com with, again, any questions for the education team.
So also we have a lot of future webinars coming up, and on our website, if you go to vatechamerica.com, click on that webinar schedule button right there, and it'll take you down to your meetings events. We have a whole bunch of upcoming events always being refreshed through there with the Vatech education team, with some key opinion leaders. So a lot of good stuff, informative stuff to help your office grow. And we want to thank everyone for joining us today over their lunch hour. Paul, thank you, and thank to all the Vatech family out there.
Thank you.